Yeah. So please go ahead and introduce yourself here.
Okay, thank you, Nikate. Thank you for having me back. It is actually one of my favorite places to come and share my work. I am enjoying this. You're an incredible host, and I've really enjoyed, chatting with all the participants from the last few times. So I'm hoping that I'm meeting many of them again. And for those who are, new, who I'm meeting first time, I'm Zia Nath, and I work as a craniosacral therapist. I specialize in healthcare, which is in the field of paramedical healthcare, natural healthcare. I also work as a nutritionist, and I work in trauma therapy, somatic work in trauma therapy. And today we are having conversations about craniosacral therapy. It's a mouthful, and I think we want to try and demystify this fine art of healing.
Yeah. So glad to have you here, Zia. Now, Zia wants me to introduce myself. I don't think I need an introduction to this group. But yeah, what is awareness all about? Awareness is all about empowerment. Okay. So we want people to empower themselves, and we want to bring processes from all over the world which allow people to, empower themselves and take stuff into their life so that they can live better lives. Okay. So within that sphere, we are attempting to create a lot of programs. We've been running programs since March, and a lot of you have been joining. So again, I don't need to really talk about what we are doing too much. So over to you, Zia, back.
Okay, thank you. So
Yeah.
thanks for the introduction, Nikate. I'm really also looking forward to our conversations where there is intersections between your work, your explorations, and also the work that I'll be talking about. So I'm
Perfect. Let's go for it. So why don't you tell us a little more about craniosacral therapy and
okay.
how you came into it and what are you doing about it and how it works? So demystify it for us.
Step by step. What I'm
Yeah.
doing about it right now is kind of, creating an awareness through Awareness Foundation. Now,
Okay.
craniosacral therapy, to get into the most basic, first to break up the word. When I first started this work about 20 years ago in Bombay, I'd finished my training, came into Bombay, started my clinic. And people were like, what? Cranio, what? They could not even say it. It was such a mouthful. Today, at least people can pronounce it. That's the progression we've had. That's wonderful. So the cranium comes from the word cranium, which is the head. Yeah, that's the cranium. And sacrum is a triangular bone, which is just above the tailbone. So from the cranium, we have attachment to the spine. The entire length of the spine goes down to the tailbone. And just above the tailbone is a triangular bone called the sacrum. And from the cranium to the sacrum, we have a fluid circulation. The circulation of cerebrospinal fluid, which is produced in deep structures in the brain. Blood that goes to the brain is filtered, created into cerebrospinal fluid. This fluid circulates in very deep brain structures. It goes down all the way the spinal canal. And it is a cerebrospinal fluid that is feeding, nourishing, and keeping alive all the nerve cells, nerve fibers, nerve tissues. So the circulation and unrestricted flow of the cerebrospinal fluid is imperative for the central nervous system and therefore for our entire aliveness and health. And the craniosacral system holds the production, the distribution, and reabsorption of the cerebrospinal fluid. So craniosacral therapist works with circulation of cerebrospinal fluid in the spine as well as circulation of fluid systems in the entire body.
Okay, so so when people do a spinal tap, they're actually taking out this fluid?
Yes, they're taking out the fluid to test it. Sometimes there is a malfunctioning in the fluid circulation, in the hydraulics of fluid circulation in the brain, and it's filling up, it's not draining. Again, they have to do a spinal tap to reduce the pressure of the fluid because it's not draining by itself. When they do an epidural, then they are putting anesthetic into that section through the dural membrane so that that area and below will go into numbness so the whole body doesn't get numb. When we have other kinds of diseases and infections of the cerebrospinal fluid, we have nervous system disorders.
Okay. So where did the system come from and how did it originate?
The craniosacral therapies.
Yeah, exactly.
So it originated in the, late 1800s. This is a very interesting story because the story, the history of the work is what is the guiding principle of craniosacral therapy as we know it today, even though it's changed a lot from, let's say, in the late 1800s when it was founded as osteopathy. It's a branch of osteopathy, it's a modern branch of osteopathy, but its roots are in osteopathy. But it's very interesting that even though craniosacral today is very different from how osteopathy was as it was originated, the principles are still very much what make the foundations of the work. And I want to tell you about Dr. Andrew Taylor Still, who is the father of osteopathy. And this is the roots of craniosacral. Now, Dr. Andrew Taylor Still was born in the 1820s in America, in Virginia. And his father was a Methodist preacher as well as a medical physician. So he took after his father and he became a medical physician. He did his internship, and then his major work as a medical physician was in the Union Army during the Civil War in America from 1861 to 1865. That's when he experienced at first hand the horrors of war and injury and illness and trauma to the human body. And soon after that, while he was working with whatever information he knew, whatever that was available in medical practice at that time, he could see that it was not enough. He also had a very traumatic life soon after that. He lost 3 of his children to spinal meningitis, that is meningitis in the spinal fluid. And then he lost his wife to childbirth after that. So that was really traumatic, having seen the horrors of war, then losing his 3 children, losing his wife. Of course, when you come into these situations and you are a medical practitioner working with the body for recovery and restoration, you start to question what this body is about. You start to question your practice and its efficacy. And he realized that the medical practice that he was doing wasn't very effective. Not only wasn't effective, it was also harmful. So in those days, bleeding the body or using medication that had arsenic, mercury, and other addictive narcotics, or amputation, this was a standard practice. There wasn't much else outside of this scope, and this was not always the most helpful. It was quite traumatic, and it was more harmful sometimes. So he started questioning, inquiring, looking inside, and because he was also coming from the background of his father being a Methodist preacher, he was starting to look at it from a deeper inquiry within. He started to look at the musculoskeletal system of the body and question the relationship between form and function. So if we have a form in a certain way, it's not random, it's not by accident. Every form in this universe has a specific function. Now, if our body has a long spine with so many joints and attachments, its function is it gives us so much flexibility, movability. We can move, we can twist, we can bend backwards, bend forward, we can stretch, because that's the form of the spine. When we have a ball and socket joint, it gives us rotation movement. So none of this is by accident. And the form, therefore, has a relationship with the function. And when he started to look at the body in the relationship of form and function, he devised a system which then later became osteopathy, where he started to work with the alignment of the body using the musculoskeletal system. He understood that if we align the musculoskeletal system back to its shape and its design, its original design as per its alignment, he discovered so many health issues were dissolving, so many injuries were being recovered, so many health benefits were happening. And this led him to discover, to explore, to study, and eventually he created his science and his whole study program, osteopathy, and he started the first college of osteopathy very late in the 1800s. I think it was almost 1890 that he started his first college of osteopathy. And he said, this goes so far back, he said that it is the first objective of a physician to find health in an individual. Disease, any doctor can find. So every time a patient came to him, he didn't look at the symptoms, he didn't look at the disease, he started looking what is working here, what is healthy, what is the design of this body, what can it do. Let's not get busy with what it can't do, let's look at what it can do. And as he started to support the body in what it can do, he discovered that the body had a self-regulatory, self-corrective process inside. And the body started to then correct itself and realign itself. What he was doing was making minute adjustments, bringing the body back to its natural design. This is the most basic principle of osteopathy as well as craniosacral therapy.
Beautiful. Can I add over here? I think, most people are always attempting to work on their weaknesses rather than work on their strengths. So if you start focusing on your strength rather than, banging your head and trying to repair what you're weak in, I think people can be much more successful. We are reading this book, Ikigai, in our book reading session. And that's what basically the premise of that book is: look for your passion. What are you good at? What works for you? And what helps other people, right? And of course, what you can be paid for. Those are the 4 premises. So if you're working with your passion, means you're good at it, right? You're not looking at something that you're bad at. So that makes it very, very interesting. Absolutely. I think that's the way to health. If you can get stuff which is working to work, then it'll automatically make the other stuff work also. Beautiful. Very, very nice.
He also recognized this actually led to the whole discovery over the years. Then as craniosacral was being created, other craniosacral practitioners started to build on this foundation principle and recognize that health is actually a force of intelligence. It's a force at work. It has its intelligence. When we create space for health, health recovers, it realigns, it self-corrects on its own. Sometimes we need to step out of the way for health to take care and do its work. So these are the founding principles. Now in the early 1900s, there was Dr. William Garner Sutherland, and he was studying osteopathy with Dr. Andrew Taylor Still. And he caught on to the seed of form and function. What is the function if this is the form? And he was looking at, a skull that was disarticulated, and our skull is made up of many bones, 22 bones. Right? And they are all put together, and there are sutures. There are sutures that are beveled. There are sutures that are interlocking. So they are joined together in different ways. The way they are joined together also has a function. If they're interlocking, they can open like this. If they're beveled, they can open like this. So they also have a certain function. And then he started thinking, because, conventional medicine was teaching that our skull is fused. In adulthood, it is fused. As infants, when we're born, it is soft and it has the capacity to compress, so it can come out of the birth passage, and a few months later, it opens up. And by the time a child is older, by 7, 8, it completely fuses, so there is no more movement. This was a conventional belief. But when Dr. Sutherland was studying a disarticulated skull of an adult human skull, he was seeing these sutures were still fitting like as though they were joints, and joints facilitate mobility. This got him stuck, and he was like, there must be something here. And he was looking at one specific suture that had a beveled joint, and when he started to look at if this was a joint and if it moved, how would it move? And this happened. This is how that suture would move. And this would be somewhere over here. This is how it is. It's beveled over here, and this is how it would move. And also because of the location that it was, some ideas suddenly, how insight just comes in from nowhere, no logical connection. It came to him like the gills of a fish. There is an inner breath. And that then took him onto a journey. A breath gills of a fish, breath in the head, and then he was like, what is this breath that would make the bones move? And this got him to explore into a completely new journey that became craniosacral therapy later. It became cranial osteopathy and then craniosacral therapy. And in his research, he realized, and then he taught through lots of experimentation also, that the fluid circulation inside that opens up, that fills up the cerebrospinal fluid, when it's produced in the ventricles, they fill up. So the brain has to expand for the filling up of these ventricles. Then it drains. So the brain is now receding. And very slowly, maybe, you know, in a minute, it happens at the pace of maybe 2 times or 3 times, that there is this breathing of the brain. It's a very slow breathing to make space for the fluid to fill up, and it's a very slow receding, like there's an inhalation, and this is happening in our brain, and there's an exhalation. Now, if the brain has to open out, we're talking in terms of microns. The movement is in microns. It's not measurable in millimeters or centimeters or anything. So if the brain has to open up, the tissue above the brain, that's the dural membranes, and the hard skull over the dural membrane also has to make space to open up. So if we have the brain here, we have the tissue here, we have the bone here, we have joints of our skull. When the brain breathes, the skull opens. When the fluid's receding, it's fusing back. And this very slow motion is happening in our skull as a response to fluid circulation that's filling up and draining down, getting reabsorbed, filling up. Yeah. Now this became craniosacral therapy. You know, very interestingly, Dr. Sutherland, to prove to himself that this insight that he got has some value, he needed to experiment on himself. So he made these helmets with leather bandages. He put it on his head, and then he tightened it to compress, you know, the head medially this way. And then he sat with it for a few hours to see the effect on his body. And then he would compress it this way. And then he would compress it this way. And he had all these different compression patterns that he created with those bandages and the leather helmet. And he'd sit and wait and see the effect. And the effects were, of course, not good. It made him vomit. It gave him migraines. He had blood pressure fluctuations. And through all this, his wife, his devoted, loyal wife, Ada Sutherland, was watching him, supporting him, taking care of him, making him recover, and making all the notes. And she wrote a book called With Thinking Fingers that documents all these experiments that Dr. Sutherland did. And when he realized what was happening with the different situations and compressions in the skull, when he had patients coming to him for osteopathy, and they'd say, I have migraines, and you know, I also have nausea with the migraine, he understood that possibly these nerves are going into compression. So as an osteopath, he started to do very gentle adjustments around the skull to disengage those specific bones, relieve those nerves, and then the patient got better. And though it was a crazy idea at that time, because his patients were doing so well, that everyone got interested. And then that was the beginnings of cranial osteopathy, which later became craniosacral therapy. It wasn't required. With Dr. John Upledger, he made it into craniosacral therapy. He opened up to lots of mothers and caretakers who were taking care of special children, so that mothers at home could have hands-on support for their children, for special kids, special need kids. And for that reason, he opened it up outside of the medical community. That's a wonderful thing that he did. And that's why people like us who didn't have a medicine background, we didn't do our MBBS, we can study craniosacral therapy. And that's how we've come to it today.
Wonderful. So it sounds pretty mysterious, and it feels as if the brain is breathing, right? So how does it work? Does it, you have to touch the skull, or it can work like Reiki or pranic healing, etc., or you have to do some manipulation?
Yeah. So, you know, craniosacral therapy, different from cranial osteopathy. or different from classic osteopathy in that there is still adjustments, manipulations, things like that is happening along the joints. In craniosacral therapy, it's very gentle work. The work is like this. A practitioner will place their hand just like this, very gentle, maybe just the pressure is like feather light touch. Now, what we are tuning into as craniosacral practitioners is not so much the mobility of the joints. We are looking at the fluid circulation of the whole body. This is the shift from osteopathy, cranial osteopathy to craniosacral therapy. The work has moved into recognizing that our body is almost 90% fluid. If we're looking at all the fluid systems of our body, lymph, plasma, blood, intracellular fluid, fluid along the fascia, the entire fascia sling system, all of it together, cerebrospinal fluid, bowel fluids, all of it comprises our body of almost 90% fluid. Even our bone cells have fluid in them. And the nature of fluid is to flow. You cannot contain fluid and not let it circulate because it will stagnate. That's the nature of fluid. So if our body internally is almost 90% fluid, it means that our body's natural health state is to be in a good, unrestricted, circulated flow. And as craniosacral therapists, we are tuning into the fluid system of the body and diagnosing, evaluating where are the restrictions that's catching the fluid circulation. And that could be bony compressions, that could be nerve impingement, that could be toxicity in the body, that could be an imbalance of pH, pH in the blood, acidic. It could be, any kind of restriction in the tissues, like people with asthma or something, or children with chronic respiratory issues have a lot of tightness in their upper chest, in the thoracic diaphragm, respiratory diaphragm. People with respiratory diaphragm tightness have lots of digestive issues. So as we are able to evaluate where the restrictions are and we release the restriction, the body is able to open up its circulation and restore itself. When we're working with fluid, we don't need to put pressure. We don't need to work hard because fluid is already flowing. It already has its own potency, its own momentum to move. What we have to do for a fluid to flow is remove the restriction, and the flow happens. And a lot of people ask, oh, your hands are just there. What are you doing? Are you doing Reiki? Are you taking in my bad energy? Are you giving me good energy? Are you calling for good energy from up? Are you praying? Because the work is so passive. A craniosacral therapist will look like this. Like this is, if I've got my hands on somebody, I stay here maybe 10 minutes, 15 minutes. It's passive. I'm not constantly moving. But in that passiveness, the fluctuation of fluid circulation is creating a vibration. And I'm able to support the body through the listening of this vibration. So it's like, imagine a lotus pond. Everyone can relate to a lotus pond. The lotus pond has such big leaves that are floating just on top of the water. And very gently, if you place your hand on one of the leaves with the intention to not disturb the water. My attention here, my presence here is not to disturb what is there, is to listen to what is there without the pond or the fish or any of the animals in the lotus pond being affected by my presence. That's the most important criteria for craniosacral therapists. So I need to therefore be so gentle with my presence and with my touch. I place my hand on the lotus leaf so gently, not to affect it with my presence, and I listen. Whatever is happening to the water underneath the leaf, I can hear. And my hands can listen.
Beautiful.
Our hands have a lot of afferent nerves. We have afferent nerves, that is nerves going out, which is to give information, right? Information from the brain going out into our hands, into our feet. That's information going out is afferent nerves. Information coming in is afferent nerves. So our hands have a lot of afferent nerves. That's why whatever we feel, touch, we have a sensory experience. So hands can pick up information. It's called listening with the hands. And if there is any disturbance in the water, in the lotus pond far away, I will feel it on the leaf. If there's any disturbance in the water underneath, I will feel it on the leaf. So I don't need to affect this or change the position or adjust it to be able to know what's happening. And if I want to now settle this disturbance again, all I have to do is keep a stable presence. My stability, my presence with a stable field will start to bring resonance to the environment around that will again, it will inform, it will share, or let's say there is a transference of the stability in my presence to the field around me. Here,
Beautiful.
Nikate, you could come in and share a little bit about this. I know.
Yeah. So I have a question here.
Yeah.
We had a talk on access bars, and they talk about these, those bars in the head, those 32 bars in the head. Now, is it very similar, craniosacral therapy? Is it very similar to access bars?
You know, I know very little about it. And the little I know is that, no, it's not similar. They're very different.
Very
So
different.
they may work with specific points, which we also study in craniosacral in terms of sutures and nerve pathways, important nerve pathways and things like that. But their methodology and application is very different. It's different from craniosacral therapy.
Yeah, and it's funny, to be frank with you, we are working a lot with Biofield training, tuning actually, and it's exactly the same way in which it works. So we are using the tuning forks to actually sense the vibrations, and the tuning forks acts as a stable field for the body to be able to understand that, okay, there's some imbalance over here, which allows the body to recorrect itself. So it's working exactly in the same way, to be frank with you. It's beautiful. I mean, so well expressed and so well explained by you. But with using the lotus pod, I'm going to use that example for biofield tuning now. So,
there's one more thing that I want to add about the lotus pond. And this is a little bit philosophical, but it becomes real because we are using it as practitioners hands-on all the time. Here it's an inquiry. If you put your hand into a lake, are you touching the entire lake or are you only touching that water?
you're touching the entire lake.
Exactly. Because it's one body of water. Correct. And here is the most important principle of biodynamic craniosacral therapy. You know, craniosacral therapy is also, there are two branches. So the biodynamic branch of craniosacral therapy brings the biodynamic principles of health. One of the first principles of health in the biodynamic work is to recognize that our body is one unit of function. So if I'm working on the shoulder and moving into the fluid circulation of the body through the shoulder, I'm touching the entire fluid of the body, not just the fluid or the tissue here. The whole body is being worked on. So when a person comes with a symptom in their neck, it's easy for us to treat the neck by working on the feet, because the body is anyways connected through the fascia sling system. It's connected through the entire fluid system. You immerse your hands into that field and you're touching the entire field in one moment.
So another question, you have these Nadi Veds, you have these people who test your pulse and then they can diagnose everything. This seems to be very similar to that kind of thing.
Yes, the palpation skill is very similar. Again, they will not affect, they have to listen in a way that their presence and the placement of the hand is not affecting the person's rhythm of the pulse. And they have to listen without affecting it, right? So the palpation skill is the same.
Yeah, great, wonderful. So what kind of, stuff that can be taken care of using this therapy? What kind of illness or imbalance in the body system?
It's easy to say that the whole body can be addressed and supported. So most immediately, of course, supporting anything to do with the cranium, central nervous system, the spine, the peripheral nervous system, neurological issues, headaches, migraines, endocrine system, hormonal problems, for babies, growth-related issues, birth trauma, And for adults, immunity issues, injuries, accidents, spine injuries. What else? I work a lot with people with digestive issues, IBS, chronic respiratory disorders, which is rampant today in the city because of pollution. Also for a lot of children, allergies, autoimmune systems. Almost everything can be supported. Many of them can be treated. And for many other issues, craniosacral therapy comes in as a very good complementary support.
Okay, great. So does it work with autism and learning disability also?
It works with autism and learning disabilities. And here is where I want to clarify. So it's not like I'm not saying that craniosacral therapy can treat autism. No, autism is so diverse. It has such a broad spectrum. So I've worked with so many autistic children, and each one is presenting so many unique health conditions, as well as really amazing talents, which for me is like, it really wows me. So it is my work to see what is uniquely beautiful about this person, and that becomes a gateway to what we can support. So for some, it's easy to support with speech development, while for some, it's really easy to support with emotional intimacy and emotional development, depending on what spectrum they're coming on and what the challenge is.
Okay, wonderful. Great. So can it work at a distance through the quantum field, so as to say? Like, for example, biofield tuning, we can do it at a distance, and we've been doing group sessions also, and people actually feel the entire process. So can this be done at a distance?
So to be very technically correct, but I have been doing remote sessions over many years, and when we do it remotely online, distance, we don't call it craniosacral therapy, because craniosacral therapy is with hands-on treatment. The touch is an imperative element in the therapy. But what I'm doing is I'm employing the biodynamic principles of health in my distance work. So I can't say I'm doing craniosacral therapy in distance, but in my distance treatments, I'm really using all the biodynamic principles of health, which is recognizing the body works as one unit of function. The body has a self-corrective, self-regulatory mechanism. So even if I'm far away and not touching, I'm still working with a system that knows how to self-regulate and self-correct. And this is right in the foreground of my awareness. And the fact that health is always there. Health is, no matter what the problem is, health is always available. The body is always seeking its natural alignment and restoration. And mostly there is the element of resonance, which from biofield tuning, that resonance plays an important aspect. So even though I'm working remotely, if remotely I'm establishing a stable field of presence, this is in resonance. The client is in resonance with my stable field, and as their nervous system moves into resonance with my stable field, that's when their nervous system is able to move into self-restoration.
Yeah.
So applying the biodynamic principles, I'm able to then work with distance therapy.
Okay. Zia, would you like to take some questions right now? There's one question here. If anyone else would like to ask any question, please raise your hand. Surendraji, please ask. Surendraji, please unmute and ask your question. You've raised your hand. Would anyone else like to ask any question of Zia? Yes, Shilpa, go ahead. Shilpa, please unmute and ask.
Yeah. Hi, Zia. I just want to know that I was working on one of the methodology called as the Touch for Health, and there is something called the Neurovascular Points. Are those similar to craniosacral? Because I mean, those are the points along the skull where we are supposed to just gently touch.
Right. So craniosacral, yes, I mean, in craniosacral therapy also work would involve supporting the neurovascular system very much. It's very much in the anatomy, physiology of the craniosacral system, and craniosacral therapy would work including that as well as a lot else.
Okay. So it is like a branch of that, I would say, you could say.
So the neurovascular system, the ventricular system for cerebrospinal fluid, the dural membranes, the circulation of blood, the filtration of blood into cerebrospinal fluid, let's say, you know, the information conduction of nerves, neurons, neuroplasticity, all of this comes in the central nervous system under the umbrella of central nervous system physiology, right? And there may be different therapeutic approaches that would then specialize on working with one or two of these things. And then craniosacral therapy really approaches the entire central nervous system. It can, by being able to support the fluid circulation, the impingements of nerve or compression patterns in cranium, or the fascial system, the membrane system, because it can address all of that. It has wider reach of what it can do.
Okay, thank you.
Thank you. Shimangla, you have a question, please ask.
Hi, Zia was asking that supposing there is the valves in the fluid going into the legs is compromised, would it help over there as well?
Because your voice is a bit soft.
Okay, so let me clarify this. She had an operation. She broke her leg, and she had an operation. Now, during the operation, when they repaired it, it seems that one of the valves with the fluids going down the leg or coming up the leg has got compromised. So enough flow is not there for whatever reason. So can this help in that? Shimangla, is that your question?
Yeah.
Yeah.
I think that I don't know if specifically it will treat and correct that problem, and to what extent, I would not know.
Okay, but it's worth a try.
That. But I think that craniosacral therapy is a very good complementary support. And if the body is, by its own mechanism, trying to support itself with this problem, craniosacral therapy will support the body in getting a better recovery.
So basically, the fluid movement is not there. The fluid coming back up, the valve is not working. Yeah.
So the valve is blocked.
Yeah. It's not blocked.
Yes.
It's not allowing the fluid. It's not, I think you can call it blocked. It's not functioning properly.
Right. Now that can happen because of shock trauma, freeze in the tissue area around that. That is not only in the valve, but there may be tissue area around it that's gone into shock and freeze that is catching it, that's restricting it. There could be many reasons around that area. If it's close to a joint, if it's close to many vascular, vessels, we don't know what's blocking it. So to give it a try, I would definitely say yes, do give it a try, because
Will do.
From far I won't know, but with hands-on
evaluation, definitely,
I can tell you what is the exact issue there.
And even if there is a supposing there is that scoliosis, I don't know if you know does this help in that also when the body is bending? And
excellent work for scoliosis. Definitely do craniosacral therapy for scoliosis. It is wonderful work. There I would say 100%. Please go for it.
And it works on distance also, of course.
I have clients who are coming to me for scoliosis at the clinic. I continued with them with distance because of the lockdown, and it was still effective. I haven't started with a client with scoliosis first time on distance. However, what I do know is because even in distance work, we are able to support alignment of the system. So even with that, I would say yes.
Even if it's at an advanced stage?
Even if it's at an advanced stage, it will still bring you a lot of benefit. It will restore your body's ability to align towards the midline. Now, scoliosis is lateral bending of the spine. Right? In an advanced stage, in an adult body, it may not straighten out completely. But one is, it will stop progressing for sure. The other is that it will start to support the muscles and fascia around it by releasing those restrictions so as not to create additional tightness. It will start to give the body a little bit more mobility and lubrication, that the body can do more things and have less pain. So definitely, and it's now again, even with adults, sometimes it may have just started 2 years ago. So that's quite recent. But if some people have had it for 20 years, then the limitation is there. But if it's a recent thing, please go for it. You can always find a craniosacral practitioner in your locality.
We have you.
Most welcome. Thank you.
Yes,
We're-
thank you so much. Thank
Okay,
you.
we'll talk about the training later, but yeah,
No, more than
definitely
the
this is
training,
something
just
that we
now the
need to work on.
treatment is,
Yes.
yeah. Thank you so much.
I mean, I would say if, you know, if you do come in for this distance therapy, I would love to support you, most welcome. And I will also see if there is a hands-on practitioner, because that will also be helpful. You can do both. Yeah, I don't want to take away the benefit of a hands-on practitioner if there is one.
In any case, just now with Corona, we are not, not
You're
visiting
all
any
hands off in
clinics.
any case.
Yeah.
And
Everything is happening.
If your body is already sensitized to, you know, biofield tuning, then of course, please come. You are most welcome.
Okay, thank you.
We'll talk about
Thank
that.
you.
Renuji, you have a question? Okay, anyone who has a question, please raise your hand instead of putting it in the chat. It makes it much easier so that we see that you're there. Renuji, please go ahead.
Zia, thank you very much. It was so well explained. I wanted to know, how can one, is it possible to have a course or something to learn it? Because it seems that if one should be able to do it, but how difficult is it to learn? That's what I'd like to know. Is it?
The wonderful thing is that the prerequisite for it is that you need to be a graduate in any field, right? So basic till you finish your college, that's important. And age, and so 21 years and older is what is required, and you need to be a graduate. And of course, you need to have an interest in healthcare. That's the only prerequisite. And it is generally a 2 to 2.5 year training, but it's done in short modules of about 5 to 10 days at a time. Then you have time in between, because you have to do hands-on practice, make reports, and submit all the, you know, all the practice sessions. You will be supported in feedback with your practice sessions, and there's a lot of learning. So everything that you need to learn in terms of anatomy and physiology relating to craniosacral therapy is taught in the course. So anybody can learn it. So now, if you want to know anything about the training, that just Google online. There are quite a few trainings happening in India currently. See which one works for you. I used to be the host and an assistant for trainings in Bombay. I used to call the Institute of Craniosacral Balancing from Switzerland here. We did that for 4 years. I've stopped it for the time being, but I think they are conducting a program next year in Goa. There are some other programs in Bangalore, in Odisha, and you know, there are quite a lot of programs happening now. So just Google and see what's happening in India. You should find something.
So this is like the training, Zia, is the training online, or is it you have to be present?
I think you have to be present. So I think most of these trainings are scheduled to start after lockdown.
Yeah, so it doesn't make sense right now. Okay.
Can I ask Zia one more thing? Aren't there any first aid few tips that you could tell us, especially for headaches and things like that, as to where you could, you know, just place your hands and because that's the normal thing one tends to.
Great. So 2 things that I want to bring in here. One is, tomorrow I'm doing a breath of life guided meditation. Now this breath of life concept comes from craniosacral therapy, comes from the work of Dr. Sutherland, who is the founder of craniosacral therapy. He's the one who discovered that there is a breath in the brain, and this breath is not related to our lung breath, not the pulmonary breath. And this breath has been with us when we were a single cell structure at the moment of fertilization. From then, there has been a breath in us as an organism, and it continues. It continues till we die, and then it continues in the field around us. So it's called the breath of life. Yeah.
Beautiful.
So tomorrow, breath of life guided meditation is really very much part of the core essence of craniosacral therapy. So please come for that, because when you come for that, you will learn how to resource your body deeply. Another second thing
Okay,
that
just 1 second, one announcement here.
Yeah.
We are having the Breath of Life meditation tomorrow. I haven't yet posted it because we post the next day's events in the evening of the previous day. So yes, we are going to have that meditation in the awareness channel. Okay.
Okay,
So all of
the
you
one.
please join.
Okay, so this is with awareness.
Yeah, yeah,
Oh,
absolutely.
lovely.
It's with
Oh,
awareness.
oh, thank you.
Okay, we are having a
Yes, oh,
session
it's my
tomorrow with
shop.
Zia again.
So if any of you want a really quick first aid, how do I support myself, please come for the Breath of Life guided meditation. Even if you don't have health issues and you are into meditation, it's a beautiful meditation. And if you have health issues, it really brings deep resources into your body to know this and to learn how to do it on your own. Plus, we'll record it, so you can always have access to the recorded guided meditation anytime you want.
So Zia, will you be live voicing it?
Yes, I'll be doing
You're live voicing it. Okay, great. Wonderful. Shushma, you have a question? Shushma, go ahead, please. Unmute. Yeah.
Hi, Zia. Can you hear me?
Yeah,
Yes,
we can hear you.
Yeah. So my question is that does this therapy help in curing anxiety as well?
Yes, it does. And even though anxiety is commonly perceived as, as mental stress or emotional stress, we also look at anxiety like whatever happens mentally or emotionally is being expressed in the body. Whether it started in the body and then led to mental or emotional stress or the other way around, it doesn't matter. It is expressing itself in the body. So when we work with the body, we're able to support how a person feels or thinks. And anxiety often is related to, in the body, in the physiology, is related to either fluid imbalance, high blood pressure, or very often in this respiratory area, like the respiratory diaphragm, the thoracic diaphragm, the respiratory diaphragm, compression patterns here, lung breath. All of this is really catching so much of fluids over here. This is also called the lymphatic lake. Maximum number of lymph vessels are here. So these are one of the areas where we feel that when we release this and make space and the body can breathe better, a lot of the anxiety settles. And there are many other conditions in the body that may be causing anxiety relating to fluid circulation. And like I also mentioned, blood pressure imbalances. So when we address it through the body, we are able to also support the mentality or emotionality of the person.
Perfect.
And how many sessions would it require approximately? Does it depend from patient to patient, or?
I like generally if it's if it is a substantial health issue, we take something around 4 to 8 sessions to really treat the problem completely. It needs a series of work, and sessions happen approximately once a week. If it's a very deep-rooted, long-term chronic issue, it may take a few months, 4 to 6 months, depending on what we're working with, how deep the trauma is, or if it's a lifestyle related issue, things like that. So it's difficult to say how long each person will take. Generally, it takes a practitioner 1 or 2 sessions to really understand and then give some feedback of what we're working with and how long it can take.
Yeah.
Okay. Thank you so much.
Shushma, I think that's true for any kind of alternate therapy that we are looking at. Because, these are, you're treating the core of the issue. You're not treating the symptom like allopathy normally treats, right? So if it's a long-term issue, it'll always take a longer time to resolve.
Yeah, I get it.
Biofield tuning also, that's what I'm finding over here, that all sorts of issues, and the body holds score. So anything that you're dealing with, you will have, as Zia very correctly said, it will be in the body as well as in the field. And you have to work with both the field and the body to really heal anyone.
Yes, I understand.
Yeah.
Thank you so much.
Thank you. Ravindraji, you have a question? Ravindraji?
Yeah.
Yeah, so just to inform everyone, Ravindraji is holding our Mudra sessions. So very much like what you're talking about, craniosacral therapy. So Ravindraji deals with mudras. So he's teaching us mudras.
Lovely.
That may be of interest to you. So we are having a session on Friday. Maybe you could, if you're free, join the session.
I
So
would
there's a lot
love
of,
to.
yeah, so there's a lot of complementary stuff going on in awareness
Okay,
for
thank
all these things. Yes,
Hello,
Ravindraji,
Zia.
go ahead.
Hello, Zia. Good evening.
Hello, good evening.
What I want to ask you is somebody suffering from high pressure of CSF and has undergone lumbar puncture quite a couple of times. Now, is it possible to find out whether the pressure still exists or it has normalized? Just by keeping the hands on the shoulder or any part of the body.
When we keep the hands on any part of the body, of course, if there is an imbalance anywhere in the body, it will affect the way the body expresses the overall fluid fluctuation. So a practitioner can have a sense, okay, there is an imbalance, there is some, compression pattern. Maybe they get a sense it is in the cranium. They may put their hands on the cranium and see where the imbalance is coming from. Is it with bony compressions? We have the wall of the eye orbit behind is a sphenoid bone, and there are
Yeah.
so many nerves that are passing through the sphenoid bone.
Yeah, the
Also,
eye has already been damaged. Some
yeah.
portion of it has already been damaged.
Now, what is your question? If we can pick up if this damage is still there or if there's any scope for restoration?
No, restoration, I don't think, because the eye parts which have been damaged permanently, that cannot be restored. Now,
Yeah.
whether can it be known without doing a lumbar puncture, whether the pressure is correct or it needs to be rectified? Just by touching the whatever you are doing.
Yeah, I would not say that we could rely only on that. That would not be accurate to rely only on hands-on palpation to know this so specifically, because the hands may pick up some other pressure imbalance also that may be additional or something else, and that it would not be as accurate.
Okay. Thank you.
Okay.
Yes, Rinkuji, please unmute.
Hi.
Yeah, go ahead.
Hi, Zia. Thank you, first of all, for holding this session. It was very informative.
Thank
I have two questions. Does this therapy help with autoimmune diseases like rheumatoid arthritis?
Yes.
And
It does. It's a very good support. It may not be able to provide complete treatment. And I'm saying it may not be able to provide complete treatment. Other than that, it provides very good support to the body. It maintains the endocrinal system. It maintains the fluid circulation in the joints. So while a person with rheumatoid arthritis may choose to be on medication or on naturopathy or on nutritional support, nutrition as medication, they can also choose craniosacral therapy as an additional complementary support for their condition.
so is it like,
autoimmune, any other autoimmune disorders also.
so is it like acupuncture that you have to come for sessions, or is it something that you can do a couple of times, a couple of sessions, and then it's taken care of, or you have to learn to do it on your own?
No, it's not. You don't learn to do it on your own. In craniosacral therapy, it is administered through a craniosacral practitioner. You have to go lie down. The craniosacral therapist puts their hands on specific parts of the body and creates that whole session space, providing the treatment. So you need to go to the therapist initially, maybe once a week. If the body takes to it really well, you could then, when I work with people with autoimmune disorders or specifically with rheumatism, fibromyalgia, things like that, they come for a series of sessions, maybe 3 or 4 sessions, and I don't see them for 6 or 8 months, sometimes a year. Then again, there may be some wobble in their life, some difficult moments, and again the disease flares up. Again, they will come, they'll do 2-3 sessions, and then they're good to go. I don't see them again for a few months or a year. So that way I've been working with people with autoimmune disorders now I have some people I've been working with for almost 10 years. And I see them 3 or 4 times a year, and that supports them, that holds them. It's kept there. Some of them are on no medication at all. Some of them keep to very minimal medication. And that way, it's a very good supportive and complementary therapy.
Great. Thank you. Samson, you have a question? Samson, please unmute. Oh, sorry. Please unmute.
Thank you, ma'am, for your informative talk. It was very informative. So just I want to know whether this is applicable for neuropathy, diabetic patients. Okay.
Well, frankly, I have had very limited exposure to that particular symptom or neuropathy.
Okay.
So I would not say no, it won't help, but I personally have not worked with diabetes patients with neuropathy sufficiently to make a comment on that.
And how can we contact you also? Your contact details.
Yes, Nikate can give my email address on the chat, or I can put it down.
Yeah, we'll connect. No problem.
Okay.
Okay, thank you. Thank you.
Okay, Rituji, you have a question?
Yeah, I have a question. Thank you for this very informative talk you've given us. It's really been great. I wanted to know, can somebody with MS be cured?
It will support it. If it's at an early stage, it can really slow down the progression.
Okay.
Cure it? No, I haven't heard of cases that have been cured. Though if it's addressed at the very early stages or a person who is young, then there's a lot more scope for recovery.
Okay, okay. And how much time would it take really, or would it have to be continuously? You would have to keep going back and forth for it?
So it is, generally, I mean, if a client is coming to me from out of town, then they come for a week, 10 days, take 4 to 6 sessions, go back and come back after 2 or 3 months. And that also works. And that we could probably be doing, for a year or something till they feel that the requirement for visit at the clinic is reducing. Again, that is so subjective to the client and the kind of disease that we're treating.
Yeah. And what stage it is in?
What stage it is in? What is the client's capacity to travel?
No. If it's in an early stage, I'm talking about.
If it's in an early stage, yes, I would recommend it. Take it out.
The patient would be able to move around and all that.
Yes. Then if it's an early stage, definitely. Please do.
It should. Okay. Thank you.
Now there are craniosacral practitioners, in many cities in India. So I'm also really happy to.
Do you know anybody in Delhi?
There are quite a few in Delhi. So just connect with me through Nikate. Nikate will give my email address to whoever wants it, and then I will connect you to whoever you. Yeah.
Thank you. Thank you so much.
In fact, one of the people who attended the Gateway Voyage is also a cranio psychotherapist in Delhi. I'll connect you with him, Rituji.
Okay, thank you, Bhaiya. Thank you so much. Thanks a lot again. Thanks again.
Kritika, you have a question?
Yes. Hi, Zia. Thank you so much for the session. I have a question in regards to if this treatment can work for issues with fertility.
Issues of?
Infertility.
Infertility. It's subjective. I would not say yes 100% for everyone. I've worked with some cases for fertility. We've had wonderful results, and some cases absolutely no result at all. So that is a bit subjective.
Okay.
Okay.
Thank you.
Sanju, question?
Yeah. Can you hear me?
Yeah, we can hear you.
Thank you, Zia. I would want to know about obstructive hydrocophalus. Can it help in children with obstructive hydrocophalus?
Yes. How old is the child?
About 6 months, which was discovered after when it was 3 months when the parents noticed it.
Yeah.
Tried a 6 months progressively.
Yeah.
A CT scan showed that it's an obstructive nature. I was wondering, instead of going in for a shunt, would it be helpful?
You may definitely need to do a shunt. I don't think that you can not, that you can skip that. You may need to definitely do that. But it will definitely, again, this is a good place for craniosacral therapy to come in as a complementary support, which will also thereby help with sometimes what is the cause for this obstruction. This is something we need to understand, and then also are there other, tissues involved that is in this obstruction? Are there bony compressions involved? Is it also
compression on the lateral ventricle?
Right, yeah. So now in this, if a client came to me in the clinic, I have come across such cases before, and especially when it's so young, I would really need to study the reports thoroughly before I make any more comments, because we don't want to we don't want to create adverse effects with the circulation within the brain at this level. So we need to ensure that it's been administered correctly, and if craniosacral therapy is not sufficient, the shunt may be needed. If the shunt is needed, then craniosacral therapy definitely will be a great complementary support for other adjacent structures within the brain related to this.
Okay, thanks. Thank you.
Shilpa, you have a question?
Yes. Does this work with the muscular system, like say frozen shoulder issues or the joint issues?
Yes. Yes, very good work. For anything to do with musculoskeletal system, very good work. Very easy to work with and good results.
Okay. Thank you so much. Wonderful session here.
Joyce? Joyce, you have a question? We can't hear you, Joyce.
Yes, I would like to know about Alzheimer's. Can you help with Alzheimer's?
In a complementary way, it won't treat Alzheimer's. It will support it. It may slow down the progression. It may give the patient many other resources, that comes with, if Alzheimer patients are also put on medication that has adverse effects on the system. So it will help with that. It will help to lower other medications coming in with the complementary support of craniosacral therapy.
Okay. Thank you.
So,
Thank you.
Yeah, one more. Rinku?
Zia, does this therapy have any adverse effects or side effects? Can something go wrong?
Principally, no, but then it depends on the practitioner. Principally, we are taught to administer the work in a way that is completely non-invasive. It is so non-invasive that when we are learning this work and we're learning how to place our hands, not only does a hand has to be so light to not affect the body, we are even working with our own presence. We are working with our attention. That everything about us is non-invasive. My attention is not peering into the body. My presence is not affecting the unique balance of the client who's coming to me. Neither are my hands. So when it is so non-invasive, we are creating a field in which the body is able to self-correct. Therefore, there can be no contraindications because the body is working with its own highest intelligence. It will not do anything wrong to itself. But if a practitioner does not have that right approach, it can create contraindications. But that I would not blame the work. I would really question the practitioner's learning or experience.
So, Zia, is it all right for pregnant ladies to have this work done on them?
Excellent. My specialization is actually in pregnancy, delivery, labor, delivery, and birth trauma. It is wonderful for that entire stage.
Okay, beautiful. Thank you. Okay, so now, I know that you are working with sacred dance and Gurdjieff movements, etc. How does this, correlate? How do they combine? How are you working the 2 or 3 things that you're doing together?
So on the outside, they don't combine. But because I've been working with it, I've been doing sacred dance for almost 25 years now. I'm doing craniosacral for 20 years. Inside me, it's like it's one space. And I feel now over the years with all the experience when I'm working with dance, with students who are in dance who don't know I'm a craniosacral therapist, or they have not had any experience with craniosacral therapy, just by watching the way that they're moving the body or the way they're holding the alignment gives me a lot of information about where the restrictions are and why they're not able to get the dance. So then the way I teach them or how I ask them to take an approach to the dance changes because I'm understanding their musculoskeletal system. Or sometimes I may guide them to craniosacral therapy or something else that may help them. Sometimes I have patients who come for craniosacral therapy and I see, okay, this system just needs to learn centering. If this system could just learn how to center, which sometimes I may not be able to do as wonderfully in craniosacral as dance would do it, then I recommend that patient to please come for a sacred dance class or join Tai Chi or Qigong or anything that can really bring them centering. And sure enough, they get into centering and, at least 80% of their symptoms are gone. So to be able to recognize what is happening in that intrinsic balance of a body, I get a lot of that through the learnings in dance, because dance is so experiential. I feel it in my own body, what is happening to my lymphatic system, to my skeletal system, to my muscles when I'm dancing. And I see that from a craniosacral therapeutic approach. And then when I'm doing craniosacral therapy to bring the wisdom of sacred dance to it, so inside me it kind of has a meeting point, though outside they're still quite different.
Yeah. But that's been my experience also, Zia, that, all the stuff that we do, it really integrates at some point. So that's the beauty of alternate therapies, actually.
There are many intersections to all of them.
Exactly.
Yeah.
So I propose an experiment to you. So we've got this technology called Biofield imaging.
Yeah.
Where if you take a photograph and send it to us, we can create a biofield image. Right. And what we've been doing is we have been experimenting with before and after the biofield tuning. Mm-hmm. And we can actually see a difference in the field, in the way that the field is showing up. So why don't we start doing some experiments where I don't think anyone's coming for touch therapy right now, but
I've started doing work at my clinic again. So I am doing distance therapy online as well as craniosacral at the clinic. So what you're saying is that we do a photograph of them before the session and then after.
And then after the session.
And you need a special camera for that.
No. You can take it with your phone.
Incredible.
Yeah.
Really?
We need a white background, about 3 feet of space on either side. 3 feet of space on the top of the head.
Right.
So, and white clothes.
Yeah. Wow. I would love to do this experiment.
Yeah. So it's actually better without clothes, but I can't afford to have people undressed and taking photographs. But so white clothes.
Nobody will come to me.
What did you say? We missed you.
I think with clothes is good, otherwise people will stop coming to my clinic.
You never know. In any case, but then you got to tell them to dress in white clothes.
Yes.
And you have a white wall in your clinic?
I have a cream wall.
Yeah, so that will also work.
Okay.
Let's do this experiment. You send me the pictures.
Yeah.
And I'll run it through the system and send the pictures back to you.
So we can also do the same with dance, right?
Yeah, we could do it with dance also. I proposed this to you previously.
Yes, I know.
So we could do it with dance also. So if someone's dancing while they're dancing, but again in white clothes with a white background. So you take the picture and then you send it, and then after they finish the dance or during the middle of the dance, we can take a picture.
And will it work if we take the picture on Zoom, like if they're in a online dance class?
And we can try. Why not? No, yeah. Zoom won't work. Zoom won't work. Yeah, because the light thrown out from the
computer.
The computer will affect the entire thing. Okay. Yeah, so it has to be a picture. Yeah. So someone can take it. Someone from their group can just take a picture. What's the problem?
Themselves in, yeah.
Exactly. Yeah. So if you have a group session, one of the participants will take a picture and then send it in. Okay, so this would be a nice experiment to do.
Absolutely. I would love to be part of that and contribute to that experiment. So definitely I'll be sending you photos. I'll check in with my clients who want to be part of this study.
Absolutely. Someone has a question. Madhubabi, please unmute and ask your question.
Meeta is ready for the experiment. Okay, Meeta, you're on. Meeta is a colleague of mine.
Okay, great.
Okay.
Madhubabi, are you still here? She's saying, does it help in psychiatric problems?
You know, I work with psychiatric problems where they are diagnosed as depression and anxiety. And with depression and anxiety, often I find it's very much in the physiology first and then expressing in how a person is feeling about themselves and then their behavior patterns. Then I also work with people with schizophrenia, bipolar, and the other very extreme cases. It helps them in a way that because they are under medication that they have to be on, the medication creates a lot of imbalance in their equilibrium, in their nervous system regulation. Because of that, they are then on additional medication like medication for bowel motions, medication for mood lifters, medication for mood suppressors. So craniosacral really helps restore the homeostasis of the body. Thereby, the patient, even though may have bipolar schizophrenia, but their physiological health is maintained. They are able to digest and eat properly. Their food allergies get treated. They have good bowel motions. They're sleeping well. They're waking up well. They have good energy during the day. When all of this is coming back into balance, then their quality of life improves and the episodes are much lesser and less intense. So in that way, it's really helpful. I also then, I'm counseling and coaching family members and helping them to help because the involvement of family members with these individuals is an integral part of the treatment. So I would never see the patient alone. I would see who the caretakers are of the patient and work with them too in a counseling way. And it's shown to be very effective from that perspective.
Great.
So is it possible to just discuss the history of a patient with you and then like you can decide how should we go about?
You're saying, is it possible to discuss the history of the patient?
Yeah, like you should know what stage the...
Yes, so these kind of cases, there's a long interview involved, right? So either the patient and family will come to my clinic for a long discussion, reports. I need to know the whole history, how it started, or we have the outstation clients. We get onto a long phone call, and that's when I take in all the information. So that is a very important part before we decide what treatment, how, things like that. I'm also a nutritionist. I do holistic nutrition. In such situations, I always bring in nutrition because I do recognize food as medicine, especially in these cases and with a lot of benefits.
Yeah, because constipation is one of the problems that they have.
And then, the thing is, and with all these problems, when the homeostasis of the body goes for a toss and there's dysregulation, then we have blood pressure issues, then we have sugar imbalances, then they will have blood pressure medication, diabetes medication, which will then create neuropathy and other problems.
No, luckily all these norms are taken care of.
Okay.
They are okay.
Yeah.
But I just wanted to know, like, the medication is there and the after effects are also there.
Yeah.
So just wanted to know how to go about it, and like if this can help, it will be really a boon.
So we can do a personal call because I will need a lot more information before I can give you, some advice specific to the case.
Okay.
Yeah.
So I'll get back to you through Nikate. I'll
Yeah.
get to see. Okay. Thank you so much. Thank you.
Yeah. Okay. So Awareness Foundation has gone virtual. I'm based out of Calcutta, but yeah, we are mostly virtual. We've got 7 or 8 programs going every day. So please join the sessions. The link is the same. So you can always join the various sessions that we are having. We are also having meditation every day at 3:45 from Monday to Friday. That's the Monroe meditation. And I find that to be extremely effective. And we get constant feedback as to how it's supporting and helping people. just by listening to the meditations. So definitely you can. Please message me. I have posted my number and you can be added to the groups. Rinkuji, you please message me and then you can be added to the groups. Okay, wait.
So if there's anybody here from my groups and you want to get onto the Awareness Foundation group and join in, I'm really happy to share Nikate's contact. Just contact me and I will let you know. And Nikate has just shared his contact now on the chat. So anybody interested, please take it.
Everyone is welcome. All the sessions, all the Zoom sessions are free for all. 90% of them. Okay. So everyone is welcome. So Zia, as always, beautiful chat, and I'm really interested in going forward. What we are doing with awareness is that we are actually creating a platform for practitioners to come on. So literally to become the back office for practitioners, and we would like to organize these courses also. So I'd like you to have a course organized for us at some point, and I'm sure that some people will join. So
my online course right now is Somatic Intelligence. I'm doing, it's basically bringing in the biodynamic principles of health with somatic work using dialogue rather than touch. So it's very effective, bringing in all the principles of homeostasis, self-regulation, and this is something that we can start online. Clients can do this as distance therapy with others. They can also do it in physical space with others. And it's a quick, it's not a long, extensive course. It's quick, it's short, over a couple of weekends. And clients can start to work with very effective results quite soon.
Okay, great. So I'll be in touch with you, Zia. I would like to start working on these courses once the website is on. We're still working on the website. We had a little bit of a mishap. And then we will start actually hosting multiple courses like this. So of course, Zia will be one of our trainers. So for dance as well as for cranio and whatever else she's doing, I'm sure she'll be conducting courses through awareness.
Yeah.
So, thank you, everyone. Does anyone have any other questions? Anything to share? Yes, Kokil. Kokil, go ahead.
Yeah. You actually mentioned something on somatic experience, right? If you could just yeah. So because I have heard of somatic courses, but then they are in person and nothing was online. So it would be nice if you could share details through Nikate Bhaiya.
Definitely. Just yeah, Nikate, you can let me know how I can give you information and you can.
Yeah, just give it to me and I'll post it. No problem.
Sure. Okay.
Thank you.
Okay.
Kokil, just send me a message and I'll send you the details.
Okay, Bhaiya. And thank you, Zia. This was an awesome session.
Okay.
And also, Bhaiya, thank you for asking the comparison. How is it similar to Access?
Yeah.
Or not similar?
So Kokil is an Access practitioner. Okay.
Often I get that question quite often.
So Kokil, just for information, Zia, Kokil actually practices Access bars.
Lovely. So, I would love to converse with you on another time to know more about Access bars. Whatever little I know they use specific, the similar points are there where the sutures, cranial sutures are important sutures. And just the approach, the palpatory skill and the approach, hands-on approach is a bit different. Yeah.
But yeah. I would be more than happy to have a conversation so we could talk anytime.
Yeah, so no, what I would suggest is, we can have a session where we have some quite a number of Access bar practitioners on our group.
Yeah.
So we'll get them on and we'll get you on.
Yeah.
And then we can actually compare notes on screen. So everyone can, I think we'll plan a session like that where they show us what Access bar is all about. I hope they can show us. I don't know there's some secrecy involved or not.
Oh, no, we can.
Brilliant, because I have some amazing images of the cranial bone from inside, from outside, the disarticulated skull, the sutures, the joints, the nerve pathways, all of that. And that's what we use in our trainings for studying and also in the keynote presentations. So I can always share that. You can bring in images from yours, and it would be lovely to do a comparative study of the two. It would be so wonderful.
Yeah, so I'm going to schedule a session where we'll get 1 or 2 Access bar practitioners and to get you in, and then make a comparative study as to what's happening, so that we can demystify the stuff further.
Yeah.
That will be interesting.
All those who are here, who are still here, I've just posted my email address, contact@gmail.com. So you can also write to me directly if you have any inquiries for sessions or trainings or somatic intelligence program, etc.
Yeah, we'll soon be listing all of Zia's programs on our website also. So you all can get information there, but feel free to get in touch with her directly. I didn't have it handy, so it's great that you posted it. Zia.
Okay, thank you.
Thank you so much. It was a wonderful session.
And I hope to see lots of you tomorrow for the Breath of Life, because that is actually, it's an extension of today's work. So I hope to see many of you for that.
Yeah, I think everyone will join.
Yes.
I don't
Thank
see
you.
people not joining.
Definitely, Zia. It's always such a pleasure to have you. I mean, I can just go on listening, and you really did a awesome job of, like explaining the whole thing. And I'm really looking forward to tomorrow.
Okay, thank you so much.
Thank you.
Thank you.
Okay, again, so Shimangla has already done the thank you. So thank you from me also. And you're very much a part of the awareness family. So it's all
wonderful. I think it's a really wonderful family. It's my favorite. It's become my favorite, audience to talk to and exchange with. And I also want to learn lots from all of you. You all are all so richly informed with so much happening. Thank you, Nikate, for creating this.
Thank you, Zia, once again. And we look forward to seeing you again. Okay. I'll schedule this comparative note taking.
Yes, lovely.
So we have, Kokil is there, Sudha is also there.
Yeah.
And we have one or two other people who are really into access bars.
Kanishk is also
really
putting
have
up
a
hand.
comparative note. It will be interesting. Kokil, is there some secrecy involved? If you can tell us.
She's saying no.
Kokil
said no. There's no secrecy.
She said there's no secrecy. Okay.
Yeah, she said.
Okay. I did hear that.
Nikate is disappointed that there's no secrecy.
No, I'm interested in digging stuff out, so.
So now what to bring out? There's no secrecy.
But we can still bring it out. What's the problem?
Of course.
Okay, so I look forward to you sending me pictures, and then we'll try to work with them. Let's see what happens.
Okay, great, lovely.
Okay. Thank you everyone for joining, and we'll see you all tomorrow. Tomorrow we have, we have the book reading. We have pranayam in the morning, book reading, and then meditation, and then of course another meditation by Zia at 9:50. So please join us for all these sessions. Look forward to seeing you.
Thank you.
Thank you again.
Thank you. Good night.
Good night, everyone. Good night.
Okay, good night.